Good afternoon, everyone. Thank you for joining us today for our presentation for healthcare providers who want to learn more about becoming board authorized to treat workers' compensation patients. I'm Adam Rossi from the Communication and Outreach Unit here at the Workers' Compensation Board. And with recent increases to medical fee schedules and the adoption of the CMS-1500 Universal Medical Billing Form, treating patients in New York State workers' compensation is now more in line with mainstream healthcare than ever before. However, there are some things that set providers treating workers' compensation patients apart, and that's what we want to review with you today. Joining me today are Dr. James Tachi, the board's medical director, Stephanie Zufali, the board's director of regulatory affairs, Angela Mahoney from our strategic planning office, as well as Paula Rauch, Christopher Failing, and Eileen Moss from our medical director's office. And they will be on hand today to answer any questions you may have. You can enter your questions throughout the presentation in the Q&A box, which should be located on the right side of your screen. There should be a little icon with either a question mark or Q&A. You can just pop that open, enter your questions in there. Again, you can enter them throughout the presentation, but we will hold on answering all questions until the presentation is finished. And we will try and answer as many of your questions as we can. But if you have questions that we don't get to today, or if you think of something after the session ends, we will be providing you with resources at the end of the presentation. So let's go ahead and get started. Again, welcome. Thank you for joining us. As mentioned, there are a few things that set providers treating workers' compensation patients apart, and that's what we're going to discuss today. The board has made great strides over the last few years in terms of streamlining our systems and reducing the amount of paperwork, making it easier than ever to be part of the workers' compensation system. We hope to encourage not yet authorized providers like you to become board authorized. More treating providers means that New York's injured workers have more options and better access to high quality health care. Let's take a look at our agenda for today. We will start with a note about the expanded provider law. Following that, we'll discuss the various disciplines and review what each can and cannot do. Next, we will provide a telehealth update, then review the basic overview of the New York State workers' compensation fee schedules and the new and updated New York medical treatment guidelines known as MTGs. We will also review the 3 musts when filling out most medical narrative reports. We will then take a look at some of the recent improvements the board has made to its systems that make it easier than ever for healthcare providers to treat injured workers. Finally, we'll conclude with how you can apply to become board authorized. And again, we will leave plenty of time at the end of the presentation to take your questions. So we'd like to start by sharing some background on the expanded provider law. As part of the 2019-2020 budget, a law was passed expanding the types of medical providers that can be authorized to treat injured workers in the New York State workers' compensation system, including licensed clinical social workers, nurse practitioners, acupuncturists, physician's assistants, occupational therapists, and physical therapists. Since the expanded provider law was implemented on January 1st of 2020, an influx of more than 18,000 healthcare provider applications have been processed to date. Currently, the board processes up to 250 applications per month, 50% of which come from the new expanded provider types. And the board is always on hand to help. We respond to approximately 400 calls, emails, and letters each week. All providers who can be authorized by the board to treat injured workers must be board authorized to continue treating injured workers. Becoming a board authorized healthcare provider will allow you to treat and bill for workers' compensation services. The board has developed a chart that specifies what board authorized providers can do within the New York State workers' compensation system. This chart shown on your screen labels which provider types can become board authorized, who can treat workers' compensation patients once they are authorized, and to view this chart, you can visit the provider page on the board's website at wcb.ny.gov and select the Expanded Provider Law section in the Resource section. Please note that certain urgent care, emergency room, out-of-state, and durable medical equipment healthcare providers are not required, and some are not eligible to be board authorized to treat injured workers. The following providers are not eligible for board authorization, but can treat injured workers and submit for assistance with disputed bills. They are audiologists, dentists, optometrists, durable medical equipment suppliers, laboratories, pharmacies, and speech pathologists. Please note, out-of-state healthcare providers can provide services to injured workers in the New York State Workers' Compensation System. However, New York State licensed providers can only treat New York State workers' compensation claimants if they're authorized by the board. This is true even if the provider has a license in another state where the claimant is getting treatment. The following providers cannot treat injured workers: massage therapists, occupational therapy assistants, or physical therapist assistants. Emergency telehealth regulations have been in place since March 16th of 2020 to allow telemedicine in some circumstances for social distancing purposes due to COVID-19. These regulations were extended in October of 2022, and we anticipate that in response to prior public comments, future permanent telehealth regulations will be forthcoming. You can stay informed on the latest updates by visiting the provider section of the board's website. One of the actions the board has taken to improve the workers' compensation system for providers and hopefully encourage more to participate is to implement new fee schedules with higher reimbursement rates for all provider types, as well as additional increases for certain specialty provider groups. For example, recognizing the need for more behavioral health providers, the board implemented a 20% increase for designated behavioral health services. More information for each fee schedule is available on the provider section of the board's website at wcb.ny.gov. Another area of improvement for the board has been the recently updated New York Medical Treatment Guidelines, known as MTGs. But first, here's a little background. In December of 2010, the board implemented legislatively mandated MTGs that fundamentally changed the delivery of healthcare to injured workers. The MTGs initially included 4 evidence-based guidelines for the treatment of injuries involving the neck, back, shoulder, and knee. These became the mandatory standard of care for dates of service on or after December 1st of 2010. On March 1st, 2013, the carpal tunnel syndrome MTG and updated versions of the then existing MTGs, including a new maintenance care program, were adopted. The non-acute pain MTG, as well as updated versions of the existing MTGs, were implemented for dates of treatment on or after December 15th of 2014. The following MTGs are effective for treatment as of May 2nd, 2022. Knee injury, mid and low back injury, neck injury, non-acute pain in shoulder, ankle and foot disorders, elbow injuries, hand, wrist, and forearm injuries, including carpal tunnel syndrome, hip and groin disorders, occupational interstitial lung disease, occupational work-related asthma, post-traumatic stress disorder and acute stress disorder, work-related depression and depressive disorders, eye disorders, traumatic brain injury, and complex regional pain syndrome. In order to assist healthcare providers with learning the ins and outs of the MTGs, the board has created MTG training. There are 2 different versions, one that provides CME credits for medical professionals and a non-CME version for non-medical professionals. To access these trainings, visit the board's website at wcb.ny.gov and navigate to the Healthcare Provider section in the middle of the homepage. Select the Medical Treatment Guidelines link, and from there, you select the training link on the right side of the page. You can access full details on these new and updated MTGs, including a PDF of the respective MTGs, on the board's website at wcb.ny.gov. Select Providers on the top of the homepage, scroll down to Resources, and select Medical Treatment Guidelines under the Treatment section. We also have an MTG Lookup Tool in the medical portal. The MTG Lookup Tool allows users to quickly determine whether a particular condition or treatment test combination is recommended, not recommended, or conditional according to the MTGs. When a treatment or test name is selected, the relevant section of the full MTGs for that condition will display. This online tool will help speed treatment decisions and ultimately provide more effective and efficient care for injured workers. To access the medical portal and the lookup tool, visit the board's website and select Medical Portal from the Online Services menu at the top of the homepage. The board has been working hard over the last few years on two major initiatives to streamline processes and reduce paperwork in the workers' compensation system. The implementation of the CMS-1500 form is one of those initiatives. Providers had previously indicated that the unique paperwork requirements in the New York State workers' compensation system were time-consuming and cumbersome to complete. To reduce the administrative burden on board-authorized healthcare providers, the board made the strategic decision to consolidate and eliminate certain medical billing forms and transition to using the CMS-1500 form, the universal claim form used by medical providers to bill the Centers for Medicare and Medicaid Services, known as CMS, as well as health insurers. The CMS-1500 initiative applies to medical bills for professional services as well as durable medical equipment, or DME, items. It does not apply to institutional or pharmacy billing, although non-network pharmacies may continue to bill using the CMS-1500 form. As of July 1st, 2022, providers must submit the CMS-1500 form. Electronic submissions through an XML submission partner is strongly encouraged, though not currently required. As part of the initiative, use of current medical billing and reports, including the doctor's initial report, or Form C4, and the doctor's progress report, Form C4.2, is now discontinued. Providers should also prominently report the injured worker's temporary impairment percentage, work status, and the causal relationship of the injury at the top of the CMS-1500 form medical narrative. Payers are required to use the new Notice of Treatment issue Disputed Bill Form C8.1b and the Notice to Healthcare Provider and Injured Worker of a carrier's refusal to pay all or a portion of a medical bill due to valuation objections, Form C8.4, with applicable claim adjustment reason codes, or CARCs, to object to medical bills. Workers' compensation payers will electronically transmit the explanation of benefits or explanation of reviews, known as EOBs, EORs, to their XML submission partner upon adjudication of the associated electronic CMS-1500 medical bills. Payers are also required to use specific CARCs on their provider EOBs, EORs when objecting to payment of a medical bill, whether the bills are received through an XML submission partner or on paper. Again, once you become authorized to treat injured workers, you are encouraged to sign up for the medical portal so you may take advantage of all the online services the board offers, including preparing for electronic submission of medical bills to payers and the board. Once you have accepted the terms of XML submission agreement, you can then discuss details of submission with an approved XML submission partner, also known as a clearinghouse. We have received a number of questions about submitting the CMS-1500 form electronically. Here are a couple of things you need to know. Electronic submission of medical bills by healthcare providers through an XML submission partner is strongly encouraged, but it is not required. When providers submit the CMS-1500 forms electronically through an XML submission partner, the XML submission partner will submit the forms to both the carrier and the board. Most medical billing software vendors partner with one or more XML submission partners. Contact CMS-1500 at wcb.ny.gov for assistance determining which XML submission partner may fit best with your system. We'd like to take a minute to highlight the many benefits of electronic submission. Providers receive confirmation within 7 days that their bill was accepted or rejected by the payer. Providers typically get paid quicker. With acknowledgement of receipt from the payer, the provider is aware that they should not resubmit the bill. Technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the payer to deny the bill. For more information, visit wcb.ny.gov/CMS-1500 or email cms1500@wcb.ny.gov. In March of 2022, the board was pleased to launch one of its most significant initiatives to date, its new and improved business information system, OnBoard, which offers stakeholders, including healthcare providers, a much easier and more efficient way of interacting with the board. OnBoard replaces our multiple legacy paper-based claim system with a single web-based platform. Stakeholders are currently experiencing several major benefits with the new OnBoard system, but because building a new integrated system from the ground up takes time, we've kicked this initiative off with some high-priority processes that benefit from moving online. OnBoard Limited Release, known as OBLR, is the first phase of OnBoard. It is designed to move key processes for healthcare providers and claim administrators from paper to online. Included is the prior authorization request process, or the PAR process, for medication, durable medical equipment, and medical treatment testing, as well as the submission of the request for decision on unpaid medical bills, Form HP 1.0. This is just one more way we're streamlining our processes to make interactions with the board as easy as possible for healthcare providers. OnBoard has been live as of March 2022. Use of the new system was rolled out in 3 phases, beginning with the submission of PARs for medication, known in the system as medication PARs. Today, providers and payers are using OnBoard to request and review prior authorization for medication, durable medical equipment, and treatment testing. And we have hundreds of these PARs successfully flowing through the system each day. 45,500 healthcare providers have registered for OnBoard, and more than 28,000 delegates have been added. Since OnBoard launched, nearly 491,000 PARs have been filed. Once you become authorized to treat injured workers, we strongly encourage you to sign up for OnBoard as soon as possible. Healthcare providers must use the medical portal to access OnBoard or to apply for or renew an authorization. The updated medical portal section of the board's website contains full details and information you need regarding how to register and get an ny.gov user ID and password to access OnBoard, and grant access to others to act as your delegate. Visit the provider section at wcb.ny.gov/onboard for a guide on registration. Assigning delegates, such as your office support staff, can assist you in OnBoard by drafting PARs, which must be reviewed and submitted by the healthcare provider. Drafting escalations to Level 2 medication PARs, which again must be reviewed and submitted by the healthcare provider. Drafting PAR escalations to Level 3 for the medical director's office review and submitted by the healthcare provider to be reviewed. Responding to insurer requests for information, and drafting and submitting Form HP 1.0. Visit the link on this slide to view a registration guide for healthcare providers. We would like to note, however, that delegates cannot do the following. They cannot accept the XML Submission Partner Agreement, register with the medical portal, or report on a provider's status. The board has developed a chart that outlines what submissions certain authorized provider types can make. You can view this chart on your screen on the provider overview page at wcb.ny.gov/onboard. Once you become a provider who is authorized to treat injured workers, you play an important role in making sure that injured workers receive the benefits that they are entitled to. And we want to ensure that you are paid promptly by the insurers as well. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies most provider submissions of the CMS-1500 form. The template includes the 3 elements to include with most narratives: the patient's work status, causal relationship of the injury or illness to the patient's work activities, and temporary impairment percentage. Again, we want to stress that this is important to include these 3 elements to ensure workers receive the treatment and indemnity benefits they are entitled to, and so you, as the provider, can be promptly paid. Additionally, a medical narrative report may be found legally defective if these elements are missing. A PDF of the report can be found at wcb.ny.gov/CMS-1500/requirements under the Medical Narrative Requirements section. For certain types of medical services or supplies, a medical narrative is not applicable. Instead, an attachment is required. For example, a radiologist should submit the radiological report with the CMS-1500, and a DME supplier should submit the physician order with their bill. A full list of attachment examples may also be found in the requirements section of the website. This chart here shows the 3 elements providers should include when submitting most medical narrative reports according to their specialty. You can view this chart at wcb.ny.gov/CMS-1500/requirements. Please note, a record, report, or opinion of a physical therapist, occupational therapist, acupuncturist, or physician assistant shall not be considered as evidence of the causal relationship of any condition to a work-related accident or occupational disease. Nor may a record, report, or opinion of a physician assistant be considered evidence of the presence of a permanent or initial disability or the degree thereof. When the medical narrative template is used, providers must attach a narrative report with clinic visit history, examination findings, including the history of the injury or illness, any objective findings based on the clinical evaluation, the diagnosis and assessment of the patient, and the plan of care. So now that you have all these details on our system, we do hope that you apply. To become a board-authorized provider, you will take the following steps. Step 1, sign up to use the board's medical portal and log in with the credentials that have been assigned to you. The medical portal is your one-stop to access training, the MTG Lookup Tool, the Drug Formulary Lookup Tool, and OnBoard, as well as a link to accept the terms of the XML Submission Agreement in order to electronically bill using the CMS-1500 form. Step 2, complete the required training specific to your profession. And Step 3, complete the new provider authorization request online application. Physicians, you should be aware that the applications will be reviewed by a medical society who will have 45 days to process the application. All applicants are encouraged to read the instructions on applications carefully and include any required attachments. More information can be found on the provider page of the board's website by selecting Apply for Authorization under the Healthcare Providers Resources section. Physicians should particularly pay close attention to the Important Notes for Physicians section, which demonstrates how to qualify for a specialty rating. You can view who can do what in the medical portal on the Healthcare Provider Overview page at wcb.ny.gov/medical portal. Also, it is important to note that providers must renew their authorization every 2 or 3 years. The renewal of a provider's authorization will coincide with their New York State Education Department license registration renewal. To streamline the process, the board has transitioned to a fully electronic online renewal process through the board's medical portal. For more information on becoming a board-authorized healthcare provider, please visit wcb.ny.gov/newprovider or email provider@wcb.ny.gov. For more information on OnBoard, please visit wcb.ny.gov/onboard. Resources include a walkthrough of the registration process, video tutorials, and recorded presentations for providers. For more information on the CMS-1500 form, please visit wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS-1500 initiative. That email address is cms1500@wcb.ny.gov. If you have provider-specific questions, you can call the helpline at 800-781-2362, or you can email mdo@wcb.ny.gov, and you can also find the latest provider updates on the board's website. Visit wcb.ny.gov and select the Provider Updates quick link on the provider page. You can stay informed by subscribing to get board notifications straight to your inbox at wcb.ny.gov/notify. You can also visit wcb.ny.gov and select Get Notifications on the bottom of the homepage. You choose the topics you'd like to subscribe to. You can also follow the board on Twitter, Facebook, Instagram, and YouTube for board news, project updates, trainings, and more. So we hope you found this presentation helpful, and we will now take the rest of the time to answer your questions. Again, please enter your questions in the Q&A panel. I see some questions have already come in. Our subject matter experts are going to take a look at those. And before we do answer your questions, I do want to let you know a recorded presentation will be available to you, as well as a copy of this slide deck. It will be posted on the provider page and on our YouTube page. Make sure you are registered for email updates so that you'll be aware when those are ready. Again, just go right to our website, scroll down to the bottom of the page, and there's a button that says Get WCB Notifications, and you can select what updates you'd like to receive. So with that, I'm going to let our subject matter experts take a look at some of the questions that have already come in, and we will be back with you shortly. Thank you.
Hi, everybody. This is Dr. Tachi. First of all, just a quick clarification. There was a misprint on one of the slides and in the narrative that went along with the slides. Both physical therapists and occupational therapists can become board authorized. Physical therapy assistants and occupational therapy assistants cannot be board authorized. So sorry about any confusion with that slide.
There was a question regarding use of an XML submission partner, which for us is synonymous with the clearinghouse. Specifically, the question was, is it the same as your electronic medical record vendors, such as Simple Practice? Typically, the vendors who do your software for your health records and for your billing often partner with a clearinghouse. And we have 6 specific clearinghouses who have been approved to send us the medical bills. What we can do for you, though, is if you're not sure which of those 6 your vendor works with, send an email to the CMS-1500 mailbox, and we'll do some of the legwork for you, reach out to the clearinghouses, and confirm for you which of those 6 already partner with the software vendor that you're working with.
There's a few questions about the CPT codes and fee schedules, etc., and instructions for obtaining copies of the medical fee schedule can be found on the board's website.
All right, thank you. I see a question from someone who seems to be a little overwhelmed or confused. And again, if you have any questions, feel free to contact the MDO's office. The helpline is right there on the screen. If you're interested in becoming a board-authorized provider and would like to learn more, you can email this provider at wcb.ny.gov. Someone there would be happy to answer any questions you may have.
There was a question in the chat on how do nurse practitioners and PAs apply to become authorized. And just to bring it to people's attention, if you're not following the Q&A in the chat, a link was placed in the chat box that brings you to the application page of the board website.
If you, there you go. If you go to our website, www.wcb.ny.gov, and click on healthcare providers, there's a link that says healthcare provider application.
There's also another question about using electronic billing, specifically if you don't have a software vendor. There are some of the clearinghouses. I know Karisk, for example, does it, and I think there are 1 or 2 others that will work with providers to accept paper bills, and then they will convert those bills and the narrative attachments to the required electronic form. So, you know, you can still bill on paper and have a clearinghouse handle the electronic part for you. There's another one saying, can we send billing electronically through ClaimMD? Pretty sure ClaimMD is one of the clearinghouses that started working with us, but is not a XML partner at this time. But I'm fairly certain that they do work with one of the other 6. I can follow up on that, and I'll just take down your name and try to get back to you specifically on that.
Hi, this is Paula from the Medical Director's Office. There's a couple questions in here about pay scales and fees. There's not like a specific pay scale per se. You'd have to look in the medical fee schedule for the CPT code that you're billing with and make a determination based on the RVUs that are assigned to it and the region, and go from there.
It's Dr. Tachi. There's a question from a newly authorized provider asking if the patient needs to have submitted their claim already and other initial steps that need to be taken. Typically, you do want to have the individual's workers' comp board claim number when you're treating them. That will simplify the processing for you and for the patient and for all of the parties concerned. That said, that it is understood that there are going to be times, particularly in emergency situations or urgent care, same day of treatment, that the person may not have their claim number yet. So you can collect obviously the person's individual identifier information, name, date of birth, etc., the date of the injury, their employer, etc. And we still, of course, want people to be treated in those circumstances, even if they don't have their claim number yet.
There's a question on obtaining the fee schedule for certain CPT codes. You can obtain a New York State medical fee schedule through Optum. I believe that information we can provide. Either you can contact us via email or look it up on our website. We do have that information available.
There's a question about a list of actively currently authorized providers. If you go to the board website, you can find a list of currently authorized providers, which provides both specialty information as well as geographic location of those providers.
There was another request for information about a billing software vendor, post and claim. I again took that information down, and we'll get back to you.
Just to follow up on the list of healthcare providers on our website, if you go to www.wcb.ny.gov, if you click the link that says healthcare providers, you'll find a link that says healthcare provider and IME search, and you can find a list there.
There's a question, does becoming, quote, board certified require that we panel with Optum or any other insurer? I'm an out-of-network provider. Just a quick point of clarification with respect to semantics or the vocabulary that we use. So we don't certify providers, we authorize providers, right? So people will obtain their board certification from their specialty societies or from their clinical specialties, but we authorize people to become providers within the workers' comp system. The answer to the specific question is no, you do not have to be on a specific insurance carrier's provider panel in order to be a board authorized provider.
There's a question asking if the practice will hold one account or each provider. Each provider would need to become authorized to treat workers' comp patients.
I might add that if you're interested in electronically billing, which we hope that you will be, each provider would also need to register separately for that.
There's a question asking if a patient saw 2 orthopedic providers in the same practice for the same body part, can the second provider bill as an initial visit? According to the ground rules, a new patient is someone who has not received any professional services from that physician, qualified healthcare professional, or another physician qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group or practice within the past 3 years. So if they're coming in and seeing the same, for the same body part, same specialty, they're not both initial visits, unless it's greater than 3 years.
There's a question about, from a behavioral health provider, about how one would market their services to workers' comp patients once they become authorized. The board really does not tell providers how to market your services per se. I would say, however, that there's a relative shortage both within the comp system and outside of the comp system, candidly, of behavioral health providers across the state. So, my guess is that once authorized, you would have no difficulty whatsoever obtaining referrals of workers' comp patients. There's a question just generically how long it takes for provider authorizations to become approved. I don't have the specific turnaround time on that. Perhaps Chris could weigh in because he supervises that process. But I would say that with all of the requested documentation submitted at the time of the initial application for authorization, it's a fairly quick turnaround time.
Most of those are processed the same day that we receive them. Keep in mind that initial physician applications are submitted to the medical society of the county where the doctor practices. The medical society has 45 days to act on the application. That's something that we don't have much control over. So physicians can take up to 45 days to process, depending on how long it takes the medical society. Other care types go directly to us here at the board, and we handle most of them the day that we receive them.
There's a question asking if all post-acute services for hospital discharges require to be submitted for authorization via OnBoard. Not all DME requires pre-authorization. If it does require pre-authorization, though, it does have to go through OnBoard. There is no longer a paper process for prior authorizations.
I would just add one other comment to Paula's answer. And it depends, of course, on the circumstances surrounding the hospitalization. But one of the pieces of advice that we give to surgical practices is if they're contemplating a surgery and they also anticipate that the surgery will specifically require post-operative services or DME, et cetera, that do require prior authorization, pardon me, that what they should do is they should submit a prior authorization request for the surgery, and then upon approval of the prior authorization request for the surgery, but before the surgical date, they should request all of the subsequent items that they might be clinically indicated and require prior authorization. That way, they will not have a lag time or any delay in the processing of the prior authorization requests for the post-operative items. Two sort of quick questions that came in at the end. One is, I did not see nurse case managers as an authorized practitioner. Are they included? And the answer is no, nurse case managers are not authorized providers under the workers' comp system. The other is that what is the difference between this and applying for Office of Workers' Compensation programs through Department of Labor? Specifically, the Office of Workers' Compensation programs through the Department of Labor is a federal Department of Labor program, as opposed to this, which is the New York State Workers' Comp program.
All right, so with that, I believe we're going to wrap it up here. Thank you for submitting some great questions. Thank you to our subject matter experts for taking the time to answer them. If you submitted a question that we were unable to answer, again, please reach out to our medical director's office helpline. The number is there on your screen. If you'd like to email them, the new email address is mdo@wcb.ny.gov. If you have questions about becoming board authorized, again, please visit the new provider page on our website, wcb.ny.gov/new provider, or you can email provider@wcb.ny.gov. Before we sign off, I would like to remind you to sign up for workers' compensation news, including information on future webinars, as well as when the recorded version of this webinar will be available straight to your inbox. You can sign up by visiting our website, wcb.ny.gov. Scroll to the bottom of the homepage and select Get WCB Notifications. Also, be sure to visit the healthcare provider specific page on our website, where we regularly share updates on what's new and important for healthcare providers to be aware of. You can visit the board's website and select the Provider Updates quick link on the provider page. We do also distribute information via social media, so please be sure to follow the board on Facebook, Twitter, and Instagram. And again, our YouTube page as well has dozens upon dozens of recorded webinars and trainings that you can find very helpful. So I encourage you to check that out as well. So thank you again for joining us. We hope that you take this information and want to become board authorized. And please enjoy the rest of your afternoon. Thank you.